Good morning, viewers. Today we are going to look at low sperm counts or oligospermia. You know, the testis is the center of production of the sperm cells. This is the testis. It produces the sperm cells. Now, the sperms in the testis grow up and then mature to become adult sperms, which have a distinct head and then the neck and then the tail. They need to swim very fast to be able to fertilize an ovum. Now, when we say low sperm count, what do we mean by low sperm count? It's a medical condition which can be caused by various conditions. One, it may be due to problems with sperm production. It could be genetic, you may be born with it, like in example, Klinefelter's syndrome. Testicular injuries or disease can also cause low sperm count. Malnutrition, nutrient deficiencies can cause low sperm count. Overheating, bathing in saunas or hot tubs can cause, or wearing tight panties can cause low sperm count. Smoking, smoking cigarettes may impair male fertility since it's known to reduce sperm count and lifespan of the sperm. Drugs, the use of cocaine and heavy marijuana is known to reduce sperm count by 50%. Excessive alcohol intake or alcohol consumption. Alcohol is toxic to the sperm and may reduce sperm count and quality. Prescribed medications are also known to reduce the sperm count and decrease fertility. Environmental toxins, radiation, heavy metals, obesity. Many studies find association between low sperm count and obesity in men. And then stress and excessive physical or mental exertion. This can also cause hormonal changes in the body that can lead to low sperm count. Varicocele is also a cause of it. Bicycling, and the blood vessels and nerves may be damaged due to the pressure from the bike seat. Now, how do we come to diagnosis of low sperm count? When you come to the hospital, what we do is we take your fresh semen, the sperm that you produce, and then we send it to the lab here in Medimoses. We send it to the lab, and then we look at the sperm under the microscope. What we are intending looking for is the activity of the sperm. Are they very active? Are they inactive? Or are they dead? We are also looking at the morphology, that is the appearance. Are they normal or the abnormal appearance? Sometimes the head may be there, but the tail may not be there. Yeah. Sometimes you see only the tail. So these are abnormal forms. We also look at infection, whether the sperm is infected or it's not infected. This we look at the Medimoses clinic. When we have a low sperm count, what happens is that you find it difficult to cause conception to occur. You know, the normal sperm count that we are looking at is about the ideal normal sperm count is 50 million to 150 million, but even 20 million can also fertilize, cause fertilization to occur. Other chronic diseases such as diabetes or liver and kidney problems can also cause low sperm count. Now, as part of examination, what we do is we also look at your testis and see whether you have a normal testis. And in the male, you want to have a normal testis, and then we also once we find out that there's a low sperm count, what we do is we look at the cause of it and then try to solve the cause, and then doing the analysis of the sperm too, we look at whether it is not very active. We also look at whether the morphology is not good. We look at whether there are infection in there. Then we customize the drug that we produce for you based on your lab reports. We look at your lab reports to produce a specialized drug formulated purposely for you based on your lab report. And then when we give this drug to you, we give you a short period between 2 to 3 weeks. You go and then you come back. Then we repeat the sperm count again. And then you see that there's a lot of improvement in your sperm quality and also the activity of the sperm, and that the sperm count also increases in number. And then you'll be able to achieve conception in a very short period. Thank you.